Welcome and thank you for joining our session today, Leveraging CENTEGIX Technology to Transform Workplace Safety. I'm Erica Calvert, Head of Healthcare Marketing at CENTEGIX, and I'm happy to be here with you all. We have an engaging event planned for you led by 4 industry thought leaders. These faculty will discuss the trends they're seeing related to workplace violence, how to break away from historical norms to elevate safety, the gaps they see in current prevention methods, and how innovative technology can help improve safety, well-being, and patient care. It's my pleasure to introduce you to our faculty for today, starting with Dr. Kevin Clower. Dr. Clower formerly served as Chief Medical Officer for HCA, Florida, Ocala, and West Marion hospitals, and held executive positions with the American Osteopathic Association, Team Health, the American College of Emergency Physicians, and Emergency Medicine Physicians. He's currently the CEO of the American Health Information Management Association. Jennifer Schmitz brings over 23 years of experience to our conversation today. She was the 2022 president of the Emergency Nurses Association and has spent her career in nursing in positions ranging from staff nurse to chief nursing officer at Southern Maine Healthcare. She is currently the vice president for client engagement with Engage, powered by ENA. Nancy Schendel-Falek is a healthcare executive and thought leader with over 30 years of experience enhancing operational excellence, system-wide alignment, and quality of patient care. She formerly served as president and senior vice president of hospital operations at Bay State Health and senior vice president of patient care services and chief nursing officer at Tufts Medical Center. Rounding out our panel, Andrea Greco is the senior vice president of healthcare safety at CENTEGIX. She spent decades partnering with customers to deliver solutions that focus on employee, patient, and family satisfaction and engagement. And her current role is focused on creating and deploying innovative, layered safety solutions that empower and protect healthcare organizations every day. We'd like to kick off this presentation with a poll, so please take a moment to look at the question on the screen and answer accordingly. All right, we will save time for questions and answers at the end of the session, but right now, I'd like to go ahead and turn the presentation over to Dr. Kevin Clower.
All right, it's time to kick it off then. So I'm excited that we're finally here. You know, it's 25 years as a practicing emergency physician and now transitioning over to the last few years as a healthcare administrator. I've never lost the commitment or the passion or the interest or the focus on workplace safety and the frustration I have with how limited resources we have and the ability to protect those who care for patients. Every single healthcare facility and every clinician and non-clinician who works in healthcare is focused on clinical outcomes and patient safety. But how can we really take care of those patients without taking care of the people who care for the patients? It's critically important. We have old questions that need to be revisited because now we have new answers. So let's talk about some of those new questions. I mentioned old questions with new answers. How do we take care of people the way that we want to? Well, we have to make sure that we absolutely have the right resources available to do so. How do we make sure that the people who are caring for patients have the same protections that others who provide a critical public service are protected, just like fire service individuals, just like law enforcement and others? We don't have the same protections in a healthcare facility. But you know, why isn't there a gold standard like in those areas for the prevention of workplace violence? There should be. Many have tried and many have fallen short because they have retrofitted technology for other purposes to focus on workplace violence, which is owed its own unique and novel solution. The technology that Crisis Alert brings forward is just that type of landscape-changing technology. And again, none of us would be excited to be talking about this if this wasn't answering these questions in a long-awaited way and really in a way that needs to be answered now. We have long since stopped asking the questions because we didn't have a good answer. Today that changes. So what's different today? Well, the necessity is always there, right? We know that workplace violence exists. And we know that some people have said, well, really, it's just part of your job. It's just part of the commitment to patients and their families that we make, because sometimes patients, whether it's a mental or behavioral health issue or for some other reason, they do sometimes commit workplace violence, families, visitors, etc. But it should never be part of the expectation of a healthcare provider, clinician, or even administrator. Anyone working in the facility should do so not under duress. So the necessity is clear. The commitment is changing. We now have legislative and hopefully soon regulatory changes that will help to push the ball forward to make sure that the right people are protected in the right ways. And also through regulatory language, we hope and we believe strongly that there will be dollars to fund hopefully the suggestions and even mandates that may come forward to protect healthcare workers. And finally, effective technology. I mentioned it earlier. It's fallen really short in past efforts, but we really are happy to talk to you today about this technology because it's novel, it's unique, and it really does not depend on the things that can fail us like we experienced at the beginning of the webinar today. If we have an intrinsic system that depends on itself and does not depend on many other weak links that can break, then you don't have to worry that when you have a technological solution that's built for workplace safety, that it will fail when you need it the most. So the long-awaited solution is here, what we're talking about today. So just briefly, necessity. I think all of you know this, but I want to bring this question back to you because it's really important. We'll ask the question again, what can we do to protect the people that care for patients? Because now we have a way to do it effectively and reliably. And you know, the partnership between the American College of Emergency Physicians and Emergency Nurses Association is really important. The collaborative notes workplace violence that have been recognized by emergency physicians and emergency nurses. In the interest of time, I won't read this to you, but the stats are clear. They haven't changed except that they're escalating. In the recent survey from the American College of Emergency Physicians, 91% of emergency physicians said, yes, I've been threatened or attacked in the past year. And over 70% said that, listen, it's been getting worse in the last year. It's about time that we use solutions that protect these people. They are our most critical resource in healthcare delivery. Whether you're clinical or non-clinical, if you're in that facility, you're there for a reason, and we need to be intentional about protecting you. So we also know that every 32 minutes a nurse is assaulted. That is a number that needs to stick in your mind, 32 minutes. So by the time we complete this webinar, it's probably going to be at least 2, if not more. And those can certainly escalate. We look at the stats here, 68% report being verbally threatened. Well, verbal threats have a high likelihood of escalating to physical threats. And just to set the context of the conversation appropriately, it's important to note that not only is the necessity there, the necessity is growing because the problem is escalating. And we need a solution more than we ever have before. So let's talk about commitment, federal legislation. We won't go through everything that's been done, but in the 117th Congress, there was a bill passed in the House, but was never considered by the Senate. Well, the basically identical legislation now, the SAVE Act, is now in the 118th Congress. There is bipartisan support. If it can make the agenda, then we believe that this will pass in this effort. And there will be federal legislative effort to make sure that hospitals, facilities, employers, anyone who's interested enough to make the change will have legislative backing and support to do so. We will also track for regulatory changes that will support the things they want you to do, which we believe in rulemaking in the regulatory side of things will absolutely happen. The landscape is shifting to make sure that healthcare workers are protected. So when we look at the states, I'll spend just a moment here. The commitment at the state level is phenomenal. All the states in orange, which are almost all of them, either have currently passed legislative efforts or they're ongoing and underway. So even at the state level, there are opportunities, and actually more than opportunities, incentives to move this forward to make sure that we're focusing on these people. The reason I mentioned this to you again is We've asked questions for decades and there were no answers, so we stopped asking these important questions. I'm calling upon my colleagues as a call to action to you to ask the questions again, because now the landscape is changing, you're getting the support you need, and now technology is catching up. Take a look at the Joint Commission. If you look at the Joint Commission Journal on Quality and Patient Safety 2022, they added standards here. I won't read them to you. You can read them. But under environment of care, human resources, and leadership, they expect the facilities that are accredited by the Joint Commission to follow these standards. When you have your triennial survey, they'll ask you these questions and ask for documented efforts to fulfill these standards. We can help you to do that in a meaningful way to make sure that people are truly protected real time, and absolutely not just protect them on paper to meet a regulatory standard. So what's different today? Well, I'm going to return to this slide and end it in this way. Necessity is there, it's escalating. The commitment is new, it's greater than it ever has been. And of course, the facilities and leaders, everyone wants to protect the greatest resource we have in healthcare delivery, which is the people delivering the care and the people supporting them. And what do we need? Now we need an effective technological solution, and that long-awaited solution is right here. It is right here in my hand with Crisis Alert, a stackable badge by CENTEGIX. I don't expect you to believe me. I know I'm passionate about it. I'm passionate about it because this is the only thing that I've seen that solves this problem. I'm going to turn this over to my colleagues, Jennifer first, and certainly you're going to hear from them a little more detail, and you make the decision yourself if you think this is novel, it is different. Does it serve your needs? Does this really signal the age of a new day in workplace safety and healthcare? I submit to you that it does.
Thank you, Kevin. Appreciate that, and appreciate you setting the stage for what we'll talk about briefly now, which is breaking safety barriers to create a new normal. It's important to recognize what healthcare organizations have done in the past. One, to acknowledge there have been efforts to mitigate and minimize workplace violence. What you'll see in the end is that none of these in particular are as effective as what's available in today's environment. So previously, de-escalation training and techniques, those were implemented with the intent on educating your staff, making them more comfortable responding in the moment, and reducing the stress in the environment. Incident reporting, still an important piece. You want to be able to track data, understand the number and types of events, but certainly not mitigating them from happening. Personal safety measures. And again, as we go through these, you will see there is a place for all of these, but it is not an individual fix. So personal safety measures do still need to be there and be in place, but often you would have seen a panic button in a high-risk area, or maybe security on site. Support and counseling services, really intended for post-event debriefing, support of the staff involved, and looking for ways to improve the safety based on the event itself. Environmental modifications, this really does, these still need to occur. They work very well with all of the other pieces to minimize any risk. But again, as you see, still does not prevent things from occurring. Zero tolerance policies. Kevin mentioned briefly, policies, regulatory, all of that it has its place, but it does not necessarily have the impact and effect we're hoping for here. So healthcare institutions adopting and responding and behaving in a zero tolerance way really will be helpful. Collaborative response teams, again, still needed, but not necessarily in the way that they have seen, been executed in some places. You may have special trained personnel, security that respond to these violent situations. And then lastly, legal and law enforcement, both. So often you'll see law enforcement become involved when these occur, and depending on the event, how does that get handled? And so do you press charges or do you not? So you can see where there have been attempts to mitigate and manage some of this, but I think as you're hearing so far, none of them independent from one another have been effective and really do need a stronger approach. So that shift in focus really is now driven for action, a sense of urgency, and maintenance in the sense of ongoing security for your team. So the previous slide recommending that all of those strategies still have a place, they remain utilized, and looking at that effectiveness and impact on workplace violence as a support to other measures. So most importantly, and Kevin hit on this nicely, is that need for a culture shift. So not only zero tolerance, but that this can't and isn't okay in healthcare as well, really moving towards that mindset. Also, the increase in advocacy and legislative efforts you heard about help raise awareness and broaden our response efforts. So workplace violence in healthcare is recognized as a very critical issue, requires comprehensive, multifaceted strategies to address. And while certainly awareness and response measures have improved, the problem continues to persist. It's driven by a variety of different things: external stressors, systemic challenges, our ever-evolving healthcare environment, but that urgent need is still there for investment in safety measures, the legislative support, and cultural change.
As both Kevin and Jennifer stated, there's an urgency to create a safer healthcare workplace, both for caregivers and for patients. And as all of you know, the people are the greatest asset. It is not the state-of-the-art equipment. It is not the fancy buildings. It is the people that are the key to delivery of compassionate patient care. Let's talk about the value of feeling safe, both physically and psychologically. When people feel safe, they are secure, they feel there's a level of trust, and they can optimally function in their environment and they can thrive. It allows people to be at their best, as compared to being in an environment where one feels vulnerable. That takes a mental health toll on people over time. Last year, the Centers for Disease Control conducted a study to look at people that were exposed to workplace violence, and this is what they found. 85% of those that were exposed to violence reported anxiety compared to those that were not exposed. 60% reported depression, and 81% reported burnout. These are staggering statistics. And so this mental health toll can clearly lead to unhealthy coping, including drug abuse, alcohol abuse, and in worst case scenario, even PTSD has been reported. So when we think about the risks of not being proactive and not investing in a stronger workplace environment, the slide depicts exactly what it is, a total imbalance. There have been over 13 strikes in healthcare, and all of them in 2024 have listed workplace safety as a key component. And this disproportion needs to be addressed by us, the leaders, and can be now with the technology available. We're at a point by not being proactive that we risk staff satisfaction and engagement, which impacts patient care, staff retention. And when people leave, it's disruptive to their environment. It is disruptive to the organization. It has a financial toll as recruiting new staff and orienting new staff hits the budget. And importantly, wisdom of people with experience leaves out the door. So it's important that we take a look at the opportunity to be proactive, and it also eliminates the fire drill that's associated with state mandates, and in the most tragic situations where workplace violence occurs, then the fear that you have federal and state oversight and putting you in a reactive mode to find a solution. So if not now, when? So what prevention methods have existed historically and how effective are they? So there are metal detectors in certain institutions, and they can pick up obviously weapons on the way into an organization. The reality is that most workplace violence occurs with items found in a hospital room or physical or verbal altercations, and they do not include weapons that are brought in externally. Static panic alarms or buttons require that the healthcare provider be able to reach one, which could be taking an eye off the threat. Then there are also communication mechanisms, including Microsoft Teams, Slack, and the like, which require also that an individual either be in front of a computer or looking at their phone to pull up an app. As we know, every second matters. And in not getting help as quickly as possible, the situation before the individual could be escalating. So in today's world, we have access to technology that can travel with your employees, be discreetly activated, and accelerate response times for the first time. And that really creates a level of safety in the workplace that we have not seen. And it is my pleasure to turn it over to Andrea, who will speak specifically about Crisis Alert and the CENTEGIX Safety Platform.
Thank you, Nancy, Kevin, and Jen. What I really want to lean into is everything that the fellow panelists have shared so far, why and how CENTEGIX was purpose-built to solve workplace violence and the needs that exist in healthcare today. So when we look at the safety platform developed by CENTEGIX, a key component of that is Crisis Alert. That's our wearable safety badge that you see here on your screen. It's one button, it's discreet, and it is assigned to every person in your organization so that everyone can be part of creating and maintaining a safety culture within your organization. It's one that works in and outside of the buildings, building to building, and you only need one button, one badge to follow you anywhere in your organization. It's one component of the safety platform, as I mentioned. Another part is the blueprint that you see here in the middle of your screen, the map. That plays several key roles in our solution. When an alert is activated and sent to responders who need to take quick action to help a person that has initiated an alert, they can see that on this map. The map's also utilized to track important assets across your organization as well. You can see those assets that are close by during alert, but you can also use it on its own to be an important part of your emergency management plan and other auditing purposes. In addition to our visitor management solution that is utilized for visitors and vendors alike, we also have a very detailed analytics platform available to share with you to see important trends and important data around how Crisis Alert is utilized throughout your organization. So we'll talk now a little bit more about specifically what Crisis Alert is and how it works. So again, as I mentioned, it's a badge that is a silent defense against workplace violence incidents. It's worn by every member of your organization. It's with them wherever they need it and whenever they need it. It enables their help to come to them directly where they are based on our very specific location accuracy information, and it also reduces the time that it takes for a responder to get to them by sharing that information. Push the button and help comes. More importantly, you probably heard me say just a bit earlier that it works everywhere within your organization. So it works inside patient rooms and hallways and stairwells. It works out in parking garages and also parking lots and spaces in between buildings. Your badge works everywhere. If you are a clinician that works in a hospital setting and then you traverse some of your time to work in a clinic, it works there as well. So you only need one badge with one simple button to call for help wherever you are. Another key component is that we utilize a LoRaWAN Bluetooth network to support our solution. So delivering an alert and asking for help to come directly to where you are does not rely on Wi-Fi or cellular service. So there are several characteristics that make Crisis Alert different from other wearables or other solutions out there, but here are some of the key components. As I mentioned, it's wearable. All staff are delivered a badge to utilize to protect them. It's discreet. When initiated, you can receive a vibration that confirms that an alert was delivered. It's important that every member of the team feel like that they are part of that safety culture, not just to ask for help for themselves, but for everyone around them as well. I shared a bit about the mapping capabilities when that picture was shown on the screen. That precise location of the individual wearing the badge is shown on the screen. That only happens when the badge button is pressed. Total campus coverage, and I mentioned inside and out, everywhere across your organization, our badge is used. One single badge to deliver help exactly where it's needed. And because we depend on that LoRaWAN and Bluetooth network, no Wi-Fi or cellular service is required to deliver those alerts and again, get help directly to where it's needed. So the Crisis Alert badge actually delivers 2 different kinds of alerts with just that one button. The button's pressed 3 times, I need help. That's a staff alert. That helps deliver response and help directly to where you are. And that's a majority of the opportunities that are used by the badge is to deliver that help directly to a person themselves. A campus-wide threat or a campus-wide alert can be used by 8 presses or more continuous pressing. In either case, both alerts are confirmed by the wearer by a vibration that says to them, help is on the way. Your alert was delivered. That allows a user to also lean into de-escalation and training so that they can help control the situation while help is on the way directly to where they are. So here's a little bit about what customers say about utilizing our solution. It's easy to use. 100% of our users said that. 98% say they feel safer and more supported as a staff member through the investment that their organization has made to utilize Crisis Alert and CENTEGIX. And then 95% say their badge helped them rapidly resolve a situation by allowing them to lean into that de-escalation training and for help to come to them quickly exactly where they are. We protect over 10 million people, not just in healthcare, but across schools and higher education, government and retail spaces. Over 600,000 of our badges are in use today, and that translates to 12,000 locations being secured. In healthcare, folks like Mitchell Cancer Center as a part of USA Health, Meridian Health Services, and Temple University trust us to protect their organization. As we think about continuing to elevate workplace safety and all the elements of the safety platform that's part of CENTEGIX Solutions, I talked a bit about our badge, our digital mapping, our reporting, and our visitor management solution as well. I want to dive in just a little bit more for just a couple of minutes around safety blueprint and visitor management. Our safety blueprint solution is the key element that shows the mapping capabilities that I mentioned around showing where an alert is, the details of assets around where an alert is initiated, and it also can be used as a digital representation of your campus anytime that you need that as well. One of the key components is that you can see that red dot with the circle around it. That indicates where an alert has been initiated. As I mentioned, we do not track badge wearers when they wear Crisis Alert badge, except for when an alert is initiated. That red dot moves with you. If you need to move away from a threat, that red dot moves as well. So that's the only time that the badge is being tracked. But we can also show that as well as key assets that might be utilized during an alert, and also where cameras are located in the event that you'd like to tie into that to put visual context around an alert that's happening real time. Those maps are also shared with key law enforcement areas outside of your organization if you would like to share those as well. The last part of our safety platform solution is around our visitor management. The reason that we like to talk about this is we know that it's really hard to manage visitor flow inside and outside of your organization, but this can also be used not only for visitors, but vendors. These badges are a bit different in that we utilize RTLS technology to track these badges. Wearers of these are not a trusted part of your organization, but are key to being there to visit family, friends, or perform work for the organization. So we track those badges, unlike the Crisis Alert, where we do not. We can show historical data and also do background checks and compare against a no-go list and help keep a centralized list for your organization as well. So I mentioned a bit about our automated reporting. We have a very user-friendly UI for all of the organizations that trust us with the crisis alert solution to allow you to export information around incidents so that you can track those. You can be compliant with other details that need to be shared outside the organization. It's accessible to all employees so that they can see how effective the solution has been for you so far. And we also automatically open incident reports that can be utilized in other compliance areas as well for details around incidents when they happen. So this is just a part of what we focus on every day. We help protect people from everyday occurrences to the extreme. And we are very proud of the fact that we can help get responders to the locations that they need to be much more quickly. So now I think that we'll take just a few minutes if we have the ability to show the outcome of our poll questions, then we can move on to our Q&A.
I do have the poll results ready to share, so I'm going to go ahead and share those now and see if we have any final questions coming in. And I have a couple questions that have come in over the course of the webinar. Someone has asked, how does this help the individual as opposed to the institution? If one of you would like to address that.
The badge is a personal safety device. Each badge is assigned to each of the wearers. So my badge would be recognized as Andrea Greco has issued an alert so that help knows where to come, and to whom it needs to go to. We believe that this is an important part of helping an individual feel safer, knowing that they have a discreet, silent way to call for help to come directly to where they are. So we believe that's a large benefit to the staff member themselves.
I would also add, Andrea, that
sure.
People are often alone when events happen. And it's very frightening, and you may not be in a situation in which you can discreetly call for help. And this badge then allows not necessarily the threat to know that you've activated help, but everyone around you to come, and keeping the individual then more grounded and hopefully less stressed in those very high tense moments.
I agree. And I've got to add just one additional comment because I think it's worth emphasizing. To the individual, it's got to impact the individual, or it's not worth considering the solution. Of course, we can talk about countless ways it helps the institution. But to the individual, it gives you that obvious feeling of comfort that if you do need help, you can get it anywhere, anytime, as Andrea so eloquently stated. What it is not must be emphasized. This is not a workflow monitor. This is not on. It is activated by the person wearing it and no one else. There is nobody that can turn it on and watch how quickly you're transporting a patient or where you are in your break time. This is solely and uniquely for the purpose of making sure that if you need help or there needs to be a campus-wide alert, lockdown, or event, that someone who has the ability to recognize it can ask for that help or call for that lockdown immediately. That sense of comfort and getting help when you need it is the greatest benefit to the individual without the downsides of having to deal with an intrusive workflow monitor. That's not what this is. It will never be that.
Thank you, Dr. Clower. We have another question that has come in through the chat. How does the badge track the exact whereabouts of the employee that needs help?
Well, certainly the digital mapping, that is one of the things I am most passionate about. Organizations are complex places. I've spent my career in major medical centers that are big, and Andrea described and showed you a slide of digital mapping. It shows where the individual is and tracks at the particular point where the individual needs help.
Thank you, Nancy. And in the event that was a technical question as well, our badges talk to other hardware that is located around the facility. These are not hardwired pieces of devices. That's why we utilize the LoRaWAN and Bluetooth networks to allow all of our devices to talk to each other. So they are placed around the organization so that we can identify that exact location of a badge wearer. They're all battery operated. None of our items need to be recharged on a frequent basis, whether we're talking about the badge, are gateways that all allow the devices to talk to each other, and none of them need to be plugged into a power source because they are all leveraging 2 to 5 year batteries for them as well.
Hey, and I've got to add, this is the footprint of your facility. This is your blueprint, all floors, with everything that you have on those floors as you need it. And I will tell you, so this is not, let's say, 3 pre-formatted footprints that you can choose from and then you scale it. This is your footprint of your facility. So going back to Nancy's important comments, if someone has a problem and they're on the 3rd floor in the clean utility room at the end of the hallway, you will know exactly where they're at. If it doesn't exist in your facility, that's not going to be on your map. And so I think it's really, really important. And as also stated earlier, the red dot, once it's activated, tracks the person. So if you're moving, the resources you need will move to you. You know, if we could, in the interest of time, Andrea, I think Alan has been very patient, and he had a comment in the chat. He wants to know more about LoRaWAN and actually how the technology works in the absence of Wi-Fi or cellular. And Alan, if I didn't frame your question right, you let me know. I'm doing the very best I can to advocate for you.
Well, I'll take a stab at that then, unless we hear or see something else from Alan. But again, we utilize LoRaWAN and Bluetooth to allow those devices to talk to each other. We do utilize a gateway that allows for direct access out from the internet to signaling externally so that we can allow all of those devices to talk to each other. So definitely more, Alan, if you're interested, we can send you technical information around how all of those work together. But to be very easy and quick to install, but also non-intrusive or reliant on any networking within a facility. I think we do have one final question if we want to take a stab at that before we wrap up here today. The question is, when tracking, can you change the call flow based on location? Floor 1 would go to Jane, but if we move to floor 2, it goes to Joe. So yes, thanks for asking that question. We have the ability to designate zones within each of your buildings and across buildings so that responders can be associated with those zones. This allows for reduction of alert fatigue, but also that you know that when you get an alert, that you are to move to that very quickly instead of having to read through it and assess, is this my area of responsibility to take action on? So yes, we can deliver personalized alert delivery or set up personalized alert delivery to those that need to take action within that specific area of your facility.
You know, Andrea, as a follow-up to that, I think it'd be helpful for the attendees, the listeners, to hear about how much is manual in the response and how much is automated. I've been very impressed with how much of the work is automated and set up on the front end based on what the facility wants. So it going to the computer network, it going to individuals. And I don't want people to think that, okay, an alert goes into a black box. On the front end, it works well, but unless someone checks something or unless Joe or Jane are available, no one sees it. It's a very, very elegant solution. So can you speak to the level of automation that makes this so easy, Andrea?
Sure. I mean, again, I think that's the backbone of our ability to integrate, but also not be intrusive on the technology or the network that exists there today. So we have the ability to showcase, as you mentioned, Kevin, multiple layers of alert delivery from our mobile application, our responder application, also as well as desktop alert and delivery to ensure that there's visibility or accurate visibility across the organization for those that need to see and hear, but that is not a cumbersome activity to perform together. I do see one more other question in the chat. I can shout out something very quickly around the system being used respectively to track investigation for workplace violence. So we do keep very detailed logs that are both available to us as well as you and your alert delivery reports as part of the UI that is part of our platform. But we also, as I mentioned, can open up incident reports and allow for information to be both housed and shared within our platform, but also then sent to other incident tracking, management, auditing as well. So we do allow for very specific detail that can be shared around the utilization of the badge, alert delivery, alert closure reasons, and how long it took, et cetera. So there's a lot of detail that we capture and can share as part of reports, but also very individual information that can be leveraged in the event it's needed.
I think that is it for our questions, and to be respectful of everyone's time, I would love to thank our panelists for this wonderful webinar, and thank you especially participants for your time and your extra time. It has been wonderful to have you, and we look forward to reconnecting with you in the future.